Hi, Dr. Hagmeyer here. Glad you made it to this side of the website. I want to thank you, for joining us here, and I'm excited about the opportunity to be working with you and helping you get your life back here in the near future. If you suffer with chronic fatigue syndrome, you suffer with brain fog, depression, anxiety, weight gain, sleeping problems, hormonal problems, thyroid problems, then the information that I'm going to share with you here in the next 10 minutes will really put an end to so many nights and days of endless searching on the internet for answers, okay? It's also going to put an end to just this downward spiral that your health has been going in, but ultimately this information is really designed to change your life. In this video, you're going to understand so much more about the symptoms that you're experiencing, really why you feel the way that you do, but most importantly, I'm also going to talk to you about how our recovery program really works and really how it will finally give you answers and also solutions to your suffering. Now, with that being said, I want to really stress how important it is that you really just watch this entire video from beginning to end prior to coming out to our office for your case review, or if you're out of state, prior to your scheduled phone consultation case review. You know, having been in practice for almost 15 years, I've worked not only with patients who suffer with these debilitating and crippling symptoms here in the United States, but I also work with patients literally all over the world. And my passion is really just to help transform people's lives using natural medicine, and I really hope to have that same opportunity with you. Now, having worked with people all over the world, no matter where you live, the frustrations people have with the standard practice of healthcare is really the same. But this is where we are so different. Rather than focusing on just a diagnosis and then trying to treat that diagnosis or trying to treat that disease, what we need to focus on is really understanding what the root cause of your problem is, and then redirect our energy and our focus on rebuilding your health. That's really the key here. You know, I've never believed that the answer to better health lies in popping more pills and more medications. And I can tell you in the last 15 years, what I have personally found working with thousands of patients is that 90 to 95% of the time, many of these chronic symptoms that I've just described that you're experiencing, they have their root causes that are steeped in several key factors. And once you identify these pieces, these patterns with very specialized testing, your health problem really can be addressed with the implementation of lifestyle changes, dietary changes, and dialing in to a very highly specific and targeted nutritional support for that particular system or systems that are failing. You see, many patients that I've worked with are taking bottles and bottles of supplements, and quite frankly, I would probably almost bet right now that you probably have a drawer filled with supplements. You have a bag full of supplements for this particular symptom or that particular symptom. And what I want you to realize here is you're really not correcting anything with this approach. Really what you're doing is you're chasing symptoms with natural supplements. That's it. And I don't personally believe that this is really the best approach to restoring health. And quite frankly, I think many times this is just a waste of not only your money, but also precious time that you really could be spent getting healthy and getting well. Now, many other patients that I've worked with have purchased some sort of online nutritional supplement protocol that is really a cookie cutter approach touted to end your chronic fatigue, touted to correct your hormonal imbalances, touted to correct your digestive problem, your diabetic problem, your adrenal problem, your sleeping problem, your stress problem, on and on and on it goes. But here again, this is really not the best approach. So although this approach, may use natural supplements, the supplements, the dosages are not specific to your needs. They're not a therapeutic dosage for what your body's requirements are. So in other words, you and every other person complaining of the fatigue, the brain fog, the headaches, the insomnia, the digestive problems, really gets the same cookie cutter treatment. And what I would tell you is that's like telling everybody who has a toothache that they should simply have their tooth pulled, all right? And there may be many reasons as to why your tooth hurts, all right? But that's not how I practice. That's not the kind of care that I would want for any person in my family, and I certainly don't want that for you either, okay? So although I don't know what's wrong with you yet, I will tell you that once I reviewed your health history forms, your metabolic assessment forms, your blood work, and we've really determined what additional testing that you're going to need, we'll be in a really, really good spot to just dial in and zero in really on where your problem's coming from, and then really address it using the best scientific, validated approach available, okay? We're not going to prescribe medications to you. So I want to switch gears here for just a moment, and over the next few minutes, I want to give you some background information on the things that I look at and the things that I find wrong with 90 to 95% of the patients that I work with. There are three things that I want you to understand prior to your case review, okay? Number one is this. We have to look at the big picture, okay? A common mistake is to simply believe that the source of the fatigue, the hormone problems, the thyroid problems, the weight loss resistance, the brain fog, the thyroid problems, the headaches, it's all stemming from the adrenal glands, okay? This is so very important because it's not uncommon for someone who suffers with chronic debilitating fatigue and depression, insomnia, to do a simple Google search and find pages and pages of information about how the cause of their problem is all due to the adrenals. And I will tell you that in 15 years of practice, this is probably one of the biggest mistakes that I see being made over and over and over again, especially with people who have tried to self-treat themselves, tried to figure out what's wrong with themselves, okay? Now, if all we do is look at the adrenals and we ignore so many of the other different causes, maybe some of the things that might be even stressing out your adrenals, you're going to be on the adrenal merry-go-round. And there's books out there that push certain cookie-cutter approaches to restoring your adrenals. But again, many of the people that contact my office, this is exactly what's happened to them. They're on the adrenal merry-go-round, okay? And I don't want you to make that mistake. Number two is we have to support the body by identifying what's wrong with it rather than guessing, okay? Again, this is a big problem that I see. I think the reason so many patients fail to improve really when trying a natural approach is that they're really just guessing about what's wrong with them and what kind of nutritional support that they need. Maybe they have a friend with the same problem. Maybe they have joined a forum on the internet. Maybe they have a friend at church who sells vitamins. Maybe they have someone who's selling this magic supplement that's going to cure you. Okay, look, there is no shortage of advertisements on the internet, the radio talk show hosts that push and sell some sort of nutritional support formula. And again, I don't recommend that you follow any of this advice unless you've probably been tested and you've really looked at the big picture, okay? Now, without proper testing, the best you can really do is guess. And I don't think you want to do that, okay? We don't ever want to take a shortcut about what's wrong with you, okay? Many people that I consult with are taking and popping supplement for this symptom, and they're taking a natural supplement for that symptom, and that really doesn't work. All you're doing again here is chasing symptoms with natural supplements. You're not taking a methodical approach to really understanding what's not working or what system of the body is failing. Now, the third point I want to make is that each patient suffering with fatigue and brain fog and hormonal imbalances and weight gain and insomnia and fibromyalgia is different. I'm going to say that again. Each person suffering with these symptoms is different. So as you can see in this picture right behind me, okay, there's just a number of potential problems or even a combination of these problems that can make you feel the way that you do, okay? In any given person that I work with, there may be 3, 4, 5, or 6 of these problems at the very root cause of their problem. And this is really what I refer to as really addressing the big picture. So right here you can see this is the symptom that you have. That's the tip of the iceberg. That's typically your diagnosis, your fibromyalgia, your celiac disease, your autoimmune disease, your diabetes, your pain. But if we stop and ask the question, why do I have these things? We're going to start to see that any number of factors such as inflammation or neurological imbalances, blood sugar dysregulation, functional hypoglycemia, gut dysbiosis, intestinal hyperpermeability, vitamin deficiencies, chronic infections, poor detoxification, that's really the root cause. So if you took 10 people who suffer with symptoms of headaches and insomnia and weight gain and brain fog and fatigue, one person, it might be certain food sensitivities and adrenal problems and thyroid dysfunction. However, in the next person having all those exact same symptoms, it might be something like a neurotransmitter imbalance. It might be a hidden GI infection. It might be a blood sugar problem that needs to be addressed. And then again, in another person with, again, all those same symptoms, it may be a combination of things like toxicity. It may be a combination of hormonal imbalances. It might be a liver and gallbladder issue, okay? So this is why you really need to look at the big picture. Again, in 15 years of working with patients, again, all over the world who have these chronic health problems, you're not just suffering with one of these, okay? That's impossible. So don't fall into this thinking that your symptoms are really just coming from one system in the body, okay? This is really why we test. This is where we're going to be able to detect what your major problem is and where your major symptoms and health problem is coming from versus what's a compensation, okay? Now, if you've been trying to self-treat yourself for any period of time, you've been working with a doctor who practices integrative medicine, and you're not feeling that much better, it's very possible that you weren't addressing the major problem, but instead addressing a compensatory problem. My job is to find out which is a major problem contributing factor to your health and what's a compensation. And that's where 15 years of experience comes in. That's where working with thousands of people all over the world comes in. So in closing this video, I just have a couple of takeaway points I really want you to remember, okay? Number one is that we all have different lifestyles. We all have different nutritional requirements. We all have different daily stressors. We all have different biochemistry. Now, what's happening with your biochemistry is obviously the key to correcting your chronic fatigue, your chronic pain, your brain fog, your dizziness, your chronic health problem, okay? So again, like this picture behind me shows, your problem could be rooted in any number of these things, okay? Number two is advanced testing that we use in our office is really going to help us dial in to just the root cause of where your problem is stemming from, okay? We will finally have answers for you in terms of why you feel the way that you do. So rather than guessing and losing out on more precious time with your family, friends, and loved ones, once we have identified all of the pieces of this puzzle, once we identified the problem, where it's coming from, we're going to be then able to be in the best position to zero in on where your problem's coming from and ultimately help you get your life back, okay? Now lastly, this is probably the most important one. I know that you're frustrated. I know that you're tired of going from doctor to doctor to doctor. And so my promise here is that not only my staff, but we promise to do everything we can to hold your hand through this process, take you under our wing so that you're not feeling overwhelmed, okay? Like the old saying goes, you know, we're going to throw you that life preserver. The only thing that I'm going to need you to do is swim towards it, okay? The rest, my staff and we're going to take care of it. And so I want you to realize that you've come to the right place, okay? Well, I want to thank you for watching this video. I can't wait to meet you. I can't wait to help you get your life back. And we'll see you real soon. Take care.